and welcome to another episode of Surrendered Birth Stories. Birth stories, birth education, and the pursuit of surrendering it all to God. Let's get started. We're changing things up a little bit today, and instead of hearing a birth story or four, we're going to deep dive into why chiropractic care is such an essential part of a healthy pregnancy. Listen to Dr. Leslie as she explains to us not just what exactly chiropractic care is and why it's so beneficial, but why it's especially beneficial during pregnancy. Also, if you're located close to Mount Airy, North Carolina, be sure to get an appointment with Dr. Leslie at her practice, Nourish Family Chiropractic. Well, welcome to another episode of the Surrendered Birth Stories podcast. I am extra excited today because we don't just have a birth story, which you know how much I love listening to birth stories, but I also like to dive into different topics surrounding pregnancy and childbirth. So today, actually, we have a guest with us who's going to talk to us about chiropractic care during pregnancy. So, Leslie, would you like to go ahead and introduce yourself and just tell us a little bit about who you are and your background and your journey into chiropractic?
Yeah, sounds good. Thank you so much, Kayla. I'm Dr. Leslie Stoklosa. I am a family chiropractor who practices mostly wellness chiropractic. And for those of you that don't know what that is, it's kind of using chiropractic care as a tool to improve your health rather than waiting until something goes wrong to patch it up. I specialize in taking care of pregnant women or being a prenatal chiropractor. And I love seeing little babies after they're born. So we take care of the whole family. And yeah, my practice is Nourish Family Chiropractic, and it is located in Mount Airy, North Carolina. And a lot of people maybe don't know where Mount Airy is, but they're familiar with the Andy Griffith Show. And Mayberry is based on Mount Airy, North Carolina. So just a nice little tidbit there for you.
That's awesome.
Yep.
So, how I always think of Mount Airy as I know I'm near Pilot Mountain whenever I'm driving up that way. Oh, I'm like, oh, Pilot Mountain, we're close to Mount Airy in the same
Yes.
area.
Yes.
Um,
hmm
so how did you get into chiropractic care?
So I started going to the chiropractor. My parents brought me when I was an infant. I can't remember if my mom said I was 6 days old or 6 weeks old. And I was a colicky baby. And they were going to a chiropractor on a regular basis, but he did not treat kids. So, because they were tired and at a loss for what to do, they pretty much handed me over to them, over to the gentleman that they saw, and said, we don't care what you do, but just like you need to help us because this is awful. And just a little bit of a backstory. My mom was pregnant to almost 42 weeks. And my labor, she says, was 39 hours. And I was a forceps delivery.
Mm.
And in the early 80s, that was like super common to use that. I know that they use more vacuum assisted deliveries now, but they use forceps, and I was a forceps delivery. And so they handed me over to the chiropractor, and he was kind of nervous because he didn't put his hands on a whole lot of kids with chiropractic care. So he worked on me the best he knew how. And my parents say that after that very first adjustment, I was a normal crying baby when I was hungry, when I needed my diaper change, and when I was tired. And they continued regular chiropractic care after that point on a more frequent basis because that is what my little body needed. But they say that it was an absolute miracle for them. Now, for them, that is their story. And as far as my story is concerned, I don't like have a whole lot of attachment, like emotional attachment to that being like the thing that brought me into chiropractic. But I think that a lot of my personality traits, I don't like to follow trends. I love going against the grain. So something that was a little bit more on the taboo side was probably what I was going to be doing in the healthcare field, even though chiropractic is like probably the least of the taboo type type practices. But anyways, I went to chiropractic school, graduated, bought a practice in Mount Airy from a guy who was retiring, and had no idea what direction I wanted my practice to go in, no idea what direction I wanted my business to go in. And then I started working with pregnant women and seeing um, more about the communication between obstetricians and women, and treatment of women in childbirth. And that brought me more of a strong conviction that that was a direction that I needed to go. Um, Again, going back to personality types, are you familiar with Enneagram types?
Oh, yeah.
So I'm a Enneagram 8.
I could have guessed that just from the
Yes.
last 10 minutes.
Right, right. So, for those of you that are not familiar, an Enneagram 8 would be called a protector or a challenger. And as I have said, going against grains, asking questions a lot, not just accepting the status quo. Those are all kind of like personality traits that have come out over the course of my life that I had no idea about. And then I learned about the Enneagram, and like all of the universe came into alignment for me. but but anyway, so part of that personality type, and I feel this very strongly, is to be that protector. I will, yeah, I will stomp on a bully. Like like it comes up so strong in my in my force that like I can't stop it. So for me, working with pregnant women is not just about squashing that relationship that they have with their provider, but offering the opportunity for women to realize the strength that they already have inside of them, the voice, the intuition that they already have inside of them, and rebuilding that trust within themselves so that they feel more confident going into a labor, delivery, and postpartum experience. And not necessarily, like I said, to like, cut down the medical profession at all, because it's 100% warranted in some situations. I just feel like the direction has been lost a little bit. So, all of that to say, I felt really strongly that during pregnancy was an area or I guess, niche that I really wanted to move towards with my specialty area within chiropractic. So, that's kind of where I'm at right now.
Awesome. Well, let's just say somebody is listening and they have either never heard of a chiropractor, or in their mind, all they know is that chiropractors crack bones.
Mhm.
So if that's all somebody knows, can you give us just like a layman's term rundown of what exactly is chiropractic care, and then why it would be beneficial during pregnancy in particular?
Sure. So, chiropractic care, this is how I describe it to patients that are coming into the office that have never been to a chiropractor before and are just like they're not familiar with chiropractic care at all. And the way that I describe it is I start off by saying that chiropractic care addresses nervous system dysfunction. And I feel like recently there has been a lot of conversation around nervous system dysregulation. And that is a super amorphous term that basically says that your body is kind of like not talking to other parts of your body very well. And within chiropractic, the brain and the spinal cord, I usually refer to as the mainframe computer. of your body. And then there are wires that go out to workstations. And the wires are your nerves. The workstations are your systems within your body. So your immune system, your digestive system, your reproductive system, your circulatory system, all of those systems are separate workstations. And the ability of your body to communicate information from the mainframe computer to the workstations is dependent upon how well your spine is functioning. And the function of the spine can be any number of things, whether it's moving well, whether it is pain free, whether the muscles around it have tightened up or are nice and loose and free. And basically, what chiropractic care is looking for are what we call subluxations. And that is a complex term for the joints and muscles in an area that are decreasing the signals that are traveling in the nerves. So, all of that to say, like I said, I feel like it gets a little bit complicated when we talk about the nervous system. But all we're doing with chiropractic care is removing any roadblocks from the communication between your brain to your body. And then going into some of the benefits of chiropractic care during pregnancy, you want that communication to be running on all cylinders during pregnancy. You want your body to be able to communicate with your baby. You want your brain to be able to communicate with your body. And if there are tight joints, if there are stiff joints, if there are painful joints, if there is discomfort, all of those things would lend to being a subluxation within chiropractic. Chiropractic adjustments are there to remove that from the system to allow the nervous system just to flow and do what it does. It allows the body to heal the way it needs to, and it allows communication to happen freely. As far as specific benefits, I know some um, women, they're like, yeah, that's great and all, but like, what does that actually mean for my body? And a lot of women, they see improved comfort in their pregnancy. They don't have as much ache and pain type situations. Their adaptability to stressful situations or physical stressors that happen in their life, they are able to adapt easier. I had a woman come in very early on in her pregnancy. She had just found out she was pregnant and knew she needed chiropractic care in her life for this pregnancy because she had not had it previously and found out about chiropractic in between time and knew that she needed to be in the office. And she had two very close family members pass away during her pregnancy. They were a little like a few months apart, but still um, just like emotional stressors happening in her body. She decided to increase her chiropractic care during that time because she knew, just from us having conversations, that her body was handling a lot. It's growing human, it's going through this emotional, stressful time. Her body is changing physically. So she needed a little bit of extra support so that the body continued to work well during that stressful time. Some other things that women report with chiropractic care during pregnancy are more ease around delivery. Their birth outcomes have been improved. They have better posture during pregnancy, which can be a game changer in setting things up for breastfeeding relationship as well. There are some that report that it reduces nausea. I have not had a whole lot of experience as far as treating women that have noticed that their morning sickness improved or anything like that during that time. But that is something that is reported. And then one thing that I talk a lot about with women is the optimal positioning of the baby while it's in utero. Making sure that there are no tight spots, no trigger points, nothing that would be restricting the baby from getting into whatever position is most optimal for them to be delivered vaginally, ideally, but in a way that is going to give the woman the least amount of stress possible.
I can just tell you that my chiropractor that I see attributes my successful natural vaginal birth of my almost 11-pound boy with his 15.5-inch round head
Oh my
to,
gosh.
to his specialty chiropractic skills. He's like, "You're welcome. You're welcome for having that baby perfectly aligned to come out."
Yes.
And it was funny. I always think about that. So thank you for the explanation of all the benefits. Um, so if somebody, like I teach childbirth classes and I constantly recommend women to see a chiropractor during their pregnancy, but some of them are very nervous. And while I can tell them all the benefits of this is why it's going to be good for you, this is why you should go, and what can they what can they expect when they walk in? Like practically speaking, what does an appointment, especially during pregnancy, look like? Like what will they physically be doing? What will happen to them so they know what to expect?
Right. So in my office, I have a lot of kind of like online tech type components to the starting place. So a woman would probably find me on Google or something like that. They would go to my website, they'd be able to make their appointment right on the website, fill out their paperwork through their email, pay their prepayment. Some chiropractic offices require prepayment for the first visit, others do not. And then they would show up for their visit. Pretty much everything would already be done. They would be able to walk in. They would greet my front desk assistant and make sure that we've got all the paperwork, we've got everything squared away. And then we would go into the room. We would talk about all sorts of history. A lot of the initial visit at my office is chatting. Any challenges with fertility, any just going through a whole history of maybe their delivery, the process of getting pregnant, how many pregnancies, how many live births, how has pregnancy been? Has there been any nausea? What kind of symptoms have they had associated with pregnancy? What kind of symptoms have they had that might be associated with pain going on in their body? Why are they presenting to my office? That is a big factor because a lot of people come to the chiropractor for pain still. Um, and as we kind of work through the conversation, they might come for pain, but they continue to come for the other benefits that I mentioned earlier. So once we get through the history, we would go through a physical exam to, I usually let people know to make sure that it's safe to work on them the way that I do, and then to figure out what treatment options are going to be best suited for them with their individual thing going on. Gather information for all of that. We also get a pregnancy wellness score through my office, and it's just a letter grade that gives you an idea of where you might be, A through F on a letter grade with your health at that given time for presentation. And then if there's no red flags and there's no need to gather any additional information through the exam, we'll go ahead and get a first treatment in on that same day. Now, some offices will do a second visit where you would get your first treatment, and that's just provider preference, I guess. And then, as far as the actual treatment goes, we use gentle chiropractic adjustments. You might have some popping sounds, and that's just pressure being released from the joints. They might use some tools that are a little bit more mechanical than hands on. They might do some massaging to help loosen up muscles along the way. They might do some stretching. They might offer some exercises that you can do at home to help what they're doing in the office move along a little bit faster, especially if you're coming in and want to get rid of some pain. And then when you are all done, we make a game plan. We've talked about what your goals are for what you want to accomplish with chiropractic care. What I usually do is I'll make a recommendation based on what we talked about with your goals and then what I have seen be helpful and come up with a recommended treatment schedule. And then they would have option to just go treatment schedule, edit it however they need to, if time is an issue, if money is an issue, whatever it is, because in my office, some care is better than no care. And then we would make a situation for either paying by visit, doing a payment plan, whatever ends up working for them. And then we just do it.
So, when should somebody start going to the chiropractor during a pregnancy?
So there's a little saying in the chiropractic community that the best time for you to go to chiropractor is when you are in your mother's womb. And then the second best time is right now. So there really isn't a hard line on when you need to start chiropractic care during pregnancy. Some women wait until they start experiencing some of the aches and pains, but really the if you want to use it as a way to prepare for pregnancy, I have some women that come in as early as like 6 weeks. And then I had a woman, her due date was or is this Friday, so tomorrow, as we're recording this. And she came in last week for the first time. So she was 39 weeks when she started into practice or started into care. And she was just like, it just got away from me. Pregnancy, this has been so fast. We have a lot of things going on, but I did want to come in, be as prepared as I can. And I mean, that's just what we're doing. She's just coming in, getting her adjustments, and then going to deliver her baby. So,
There you go.
yeah, it could be anytime.
So, say that money is not a factor or, you come up with a payment plan or something. How often, on average, do you see women during their pregnancies? Is it like once a month or every other week or every week? Or how often do you recommend people go?
So that will be an it depends answer. Typically, if I have a woman that's coming in and she's having something active going on, um, the most I will usually see someone in pregnancy is twice a week. So we might start with twice a week and do that from anywhere from 4 to 8 weeks, and then back off to once a week and kind of stair step that down to every other week or once a month in the middle of her pregnancy when everything's feeling good, symptoms are good to go. But typically, towards the end of pregnancy, women want to increase their frequency of coming in because, as you're familiar, relaxin is a hormone that kind of allows for incredible flexibility of our bodies during delivery, but it also kind of works against adjustments holding their place well. So women will typically feel like their adjustments don't hold as long, they don't feel as good for as long of a period of time. So it really does depend, but I go to the chiropractor myself. I'm not pregnant, but we go and get checked up every other week consistently, whether we've got some stuff going on or not. So that's kind of the frequency that I recommend to people.
From personal experience, I think I went when I was having no issues like once a month. And then as I got later, like into the third trimester, I started going every couple weeks. And then by the time I got near, like closer to the end, I was definitely going every week. And then
Yeah.
I went to 42 weeks. So I was going a couple of times a week in those last few weeks for sure.
Yep. It really does depend.
Can you tell us about what a Webster's certification is? Because ideally, we'd love to send everybody to you for their chiropractic care, but not everybody lives near Mount Airy. So,
Right.
um, can you tell us what a Webster certification is and why that would be important when seeking out a chiropractor in your area?
Sure. So, a Webster certification is a certification that is offered by the ICPA, which is the International Chiropractic Pediatric Association. And the Webster technique is a way to remove restriction in movement in the pelvis and abdomen area of a pregnant woman. So, ideally, This would be utilized throughout pregnancy to balance the movement of the pelvis. A lot of women find a Webster certified chiropractor because their baby is breech. And as chiropractors, we don't turn breech babies, but what we do is remove restriction, again, looking at getting that optimal position for the baby. So remove any restrictions in the pelvis and in the abdomen to make sure that baby can move as freely and get into the position that's going to be best for delivery. So, as far as being a Webster certified chiropractor, you can search for them locally on the ICPA website, which is ICPA, the number 4kids.org. And you can put in your zip code and search for a chiropractor that is close to you if you are looking for someone.
Awesome. So we know that it's very beneficial to go during pregnancy. Why would somebody need to or want to go to the chiropractor in their postpartum? And why would they want to take their baby?
This is a big one. um, there's all sorts of different reasons to bring your baby to the chiropractor and then also continue care postpartum for yourself. But one of the things that I am also passionate about in the postpartum time is breastfeeding. And I had, I mean, you name a challenge and I had it with my first. In our area specifically, there's really a lack of support. And I wanted to change that. So I talked to a lot of women about getting support for lactation before they have their baby, supporting them in those first, especially those first like 3 weeks where everything is just like so tender. Mom's emotions are tender, body is tender, baby is tender. The entire family dynamic has just been like flipped on its head. So during that time, I really want to make sure that a woman feels supported during that time. Um, as far as chiropractic care for those type of things, I do have additional education around oral ties, tongue tie, lip tie, buckle tie, which are cheek ties, which a lot of people are not familiar with. But I have a lot of education around that. I do typically screen. I don't do a full functional assessment. I leave that for the professionals that are well versed in ties, but I do an oral screening and then make appropriate referrals in the infant new visit. And then going back to the nervous system, a baby's body is changing so fast. They are developing, and a lot of the things that parents complain about with their newborn can be improved with their nervous system running on all cylinders. So, colic, reflux, tension in their body, and challenges with breastfeeding, if there's challenges with latch, having body work done. I also do cranial sacral therapy. So having some body work done, chiropractic adjustments, and cranial sacral therapy together can really improve the way that the parents experience their baby and then also the experience of the baby in general.
I didn't know you did craniosacral. I'll have to have you on for another episode to explain all about that because that's like a whole nother thing.
Yes, it is.
Yeah, that's something I actually didn't even find out about until after I had my last one, after I had my fourth. I had never even heard of it. And I've been in the birth world for years. So, and there's only like two providers that I know of, well, that I've had to ask around for, but that I know of even close to me. So it's
Right.
a smaller field, but a very important one.
Yeah, for sure.
I remember taking my second, because I didn't actually start going to the chiropractor until my second pregnancy because I knew none of this. And I remember we took him for his first adjustment. And I don't remember exactly how old he was. I just remember I was still kind of waddling and still wearing big pads and I was still in that phase. And he had not slept more than, I think, an hour and a half was like the longest stretch of sleep he had in the
Mhm.
weeks. And after we left the chiropractor and he got adjusted, we came back and I nursed him and he went to sleep for 5 hours.
Yep.
And I was like, can I come back tomorrow? Like, that was amazing.
I know. Yes, please sign me up.
So, in this current pregnancy that I have, I've been going every week. Actually, started right after I found out I was pregnant because I did hear that it could help with nausea, and I always get really bad nausea. So, I wanted to just throw everything at the nausea that I could, just to say that, well, hey, at least I tried it. But it can be expensive to go every week if you're just paying like per visit. But if you, I talked with my chiropractor, which I was in relationship with already. I wasn't a brand new patient, and worked out just like a plan, like how much would it cost for me to come every week for a month. And so then it was like a monthly payment instead of a weekly payment, and which made it easier. But it's been super helpful because I think I've had, just with a fifth baby and being older than I was 10 years ago, it's helped a lot with aches and pains. Like, I've had, of course, hip pain that just comes, I feel like, with all pregnancies. And so he works on my hips every time. And then I had SPD at the end of my last pregnancy. I got it about halfway through this pregnancy. So he works in my pelvic area a lot in each visit as well, which has really helped as well. I also do wear a pregnancy support band belt thing for my back and my belly that I think has also helped with that. But just, it's like the longest I've gone in this pregnancy without going to the chiropractor was 3 weeks. And it was just kind of due to like being out of town and then their office being closed. It was just sort of like a combination of a few different things. And during those 3 weeks, I I was in more pain and like more uncomfortable. And I remember when I finally came back, I was like, I can never go that long without seeing you again. I feel a huge difference in going. So it's definitely, when my husband and I were planning this pregnancy, chiropractic care was part of the plan. I was like, do not forget to budget in chiropractic care for this pregnancy. Like, that was a plan right from the start. So, is there anything else you want to share before we end, just about really anything that we've talked about today, or anything maybe that we've missed? Anything else you had wanted to mention?
I would probably just say that for individuals that are maybe a little bit skeptical of chiropractic care in general, or have not heard of going to the chiropractor during pregnancy or for their kids, to just give it a try. They might be surprised with all of the things that chiropractic care can help with. And especially during pregnancy, if you are one that wants to do any and all things to give yourself the most positive outcome with your delivery and your baby a positive start in life, chiropractic care can be a part of that. Not saying it's going to do all the things, but it will for sure be a part of it. And if you are looking for a chiropractor, I definitely recommend that you search on the interwebs, and then also ask your community who they recommend, because that is going to be different for everyone. And then just know in yourself and in your body, in your intuition, if you get a bad feeling going into an office, might not be a good fit for you, but there are other chiropractors that you will feel either safe excited, hopeful about the possibilities. There are offices like that. I like to think that mine is one. But yeah, just listen to what your body's telling you. Pay attention to your intuition, even the little whispers, and just trust that you'll be able to find somebody that can help you truly have a lovely experience during this time that's so transformative for women.
Awesome. Well, thank you so much again for coming on and sharing everything with us. And I will list all of your information in the show notes so that if there is anyone listening near Mount Airy, that they'll be able to look you up very easily.
Awesome. Thank you so much. This was so
Awesome.
fun.
Well, thanks for coming on. And actually, in the future, we're looking forward to hearing your birth stories, correct?
Right. Right.
Yes.
Yes.
So I'm excited to hear about those, but we'll save those for another episode.
Awesome. Thank you.
All right. Thank you, Leslie. Thanks again for joining us today. Be sure not to miss an episode by hitting subscribe. Also, we'd love for you to leave a review of the show so that more people like you can hear more stories like these. If you're local to the Triad of North Carolina and seeking childbirth classes, birth consultations, or a birth doula, please click on the link in the show notes to take you to our website for more information. Just as a reminder, this show is not giving medical advice, so please continue to see your personal care provider as needs arise. Also, if you would like to be a guest on the Surrendered Birth Stories podcast, please click the link in the episode show notes to get in touch with me. We hope you have a great week, and remember, learn all that you can, make the best plans, and then leave it in God's hands.